All right, so you are in studio. I'm excited. I get to return the favor. It's only here in Delray. It's not at Stanford University, by the way. Frank, thanks for coming in.
Thank you for having me. This is great.
Would you introduce yourself to our crowd?
Sure. So I'm Frank Dolan. I am the founder and CEO of a company called Arsenal Advisors. It was built really out of necessity about 2 years ago after being sentenced for about 21 years in biotech, 7 different companies, 3 buyouts. Ultimately learned a lot about startup, turnaround, and buyout. And as I take a look at the industry, kind of our mission is we want to help propagate, ideas and experience, and we believe that'll turn that into innovation. Because at the end of the day, I think many of us can speak to it that are in the life sciences industry at some point. We're all patients, so we're into helping leaders solve the problems of the industry because there's always a patient around the corner that's going to need that innovation.
And when you were kind enough to invite me out for the fireside chat that I put on with Omar at Stanford, which was a real treat for me, and you said something there that I think always stuck with me is about the patient in your own home.
Yeah, I mean, these are, I think, emotional stories for a lot of people, for sure. And I will tell you that, and there's so many people that can relate to this, and they've had it harder than we've had it or what have you. But I spent my entire career, since I stepped off college campus, I walked into to a pharma company, and then, add 21 years, there we go. Every meeting, every brand plan was about this patient narrative, patients first, and we're thinking about that and what we do and getting through the hard stuff. The budgets at the best companies I worked for were very patient centric, and it's amazing when you have that experience in your life where a narrative that you know so well becomes completely flipped upside down when there's a patient in your own home. And I think that if that patient in your life, whoever you may be, doesn't have an innovation available to them, I mean, that sense of urgency and purpose and drive goes through the roof. And the problem that I had was that coming from the industry, with great respect to the amazing people that I've met, gave me an incredible living along the way, but gosh, there's a lot of waste in time sometimes, excessive process, lack of getting back to the vision. And at some points, respectfully, there were organizations I worked for that were not necessarily patient-centric. And I think that if we added up all of those minutes that we could have left boardroom seat early, if we took out all of that process that wasn't necessarily needed but was part of the old guard thinking, what if for our family that could have sped an innovation to the market 6 months earlier, especially if you're up against a ticking clock? And so that's what really motivates me to help folks get out of the castle walls, share some ideas, think about things a little bit differently, and really go ahead and make a difference. Because I believe we think we understand the narrative, but when your definitions get shaken, the world looks different.
Yeah, and explain, you had shared with me, so you're at Stanford, you're at Wharton, you're at Harvard. What am I missing?
We're at UC San Diego.
And so what's the makeup of the events, and what's the intention?
Mm-hmm. Yeah, so we created this thing called the Life Science Leader Summit, and it's meant to be private, exclusive, as our friends in the UK say, Chatham House rules, where we are going to have a real conversation. When you think about being a life science executive and you're relatively ambitious, you see the world a little bit differently, bigger, outside of your company, it's hard to find a form of peers to really ideate on the biggest issues that we face as an industry. And so this summit is meant to have a very robust conversation around 5 or 6 of the biggest topics that face us, both as professionals, as leaders of organizations, and what we're trying to accomplish with our companies and in our brands. So it's not meant to be slide decks that get approved by legal and regulatory. These are panel discussions, table discussions. They're a lot of fun. And we've decided to put something as serious as this, unlike a conference with exhibit halls and lots of fantastic solution providers all around, to be more of a private type of thing. And we do it with about 35 people, and we decided to put it on the grounds of institutions that are also aligned to our mission, which is to advance knowledge and to create innovations that help the world.
Yeah, and what was nice is you had that mix. So as you said, you started in pharma and then went over to biotech, but also there was a healthy dose and representation of medtech people. And I really appreciated that because oftentimes, the pharma, biotech will elite themselves away from the knuckle draggers that we are in the medtech industry. And so, it was great to have some of the groupthink, and I mean that in a positive way, revolving around some of the challenges in the respective healthcare market. Because at 18% GDP, we need to do something as an aligned industry to start cracking that down.
Yeah. So I do think spreading ideas around it's an amazing concept. And what's great about mixing these audiences, which I agree, I think about when I was hiring people over the years, coming from a biopharma, perspective, if we had a marketer from med tech, it's like, they're not going to really understand our language. They'll get our table manners around here. But God, the ideas that you spread ultimately are both constituencies serving patients. Yeah. Are both highly regulated? For sure. Are there challenges with innovation, improving concepts, and getting patients to be in trials and all this other stuff like that? Absolutely. Why wouldn't we share more ideas? And so, the cascade is we want to get these executives outside their organization, get exposed to other folks that they realize they have more in common than they might think walking into Stanford or Harvard or what have you. But also across the sector, medtech, there's just a lot to learn. I think the medtech industry, and compared to biopharma, this is just my opinion, you guys innovate faster. The product life cycles, the innovation cycles are very, very different. Well, what could that teach biopharma, which often have more prolonged cycles? Because one would say if we are innovating with everything that we do, we should be becoming more efficient. We should be becoming faster. So why wouldn't we hang out with our brothers and sisters from medtech and learn from them on how do you operate quickly, how do you fail fast, and deal with the talent and the internal process that goes along with it.
And that's a great point. And you and I are fortunate to live in what I believe is the yin and the yang. As we're in the most pitiful part of healthcare, and we're in the golden age of healthcare. And why? Is we've got the opportunity of convergence here, of biotech, pharma, device. We're seeing more and more solutions come with site-specific drug, gene, biotech therapy or solutions, right? So that's number one. Then now we're in the very early stages of dataism, right? So whether it's retrospective or prospective data on clinical trials and outcomes there, and real-world evidence versus non-real-world evidence, and having a combination drug, device, biotech all play together. And now digitally taking what that base is of that patient and be able to dial in what they're pre-wired for, because genetics loads the gun, lifestyle fires it. And so now we're able to get all this digital data, have it converge, and offer 3 different solutions based on what is required, and start to get involved in predictive analytics about what is my little 10-year-old, potentially wired for, and I want to be able to get metrics on him or her on a daily basis. And the second he goes out of the control limits, something in the sky goes off and says, uh-oh, let's get down to the GP, because now we know from a biotech perspective, the pharma that he or she's on potentially for, playing defense against what they're, been genetically cursed with. And then if I need a device to deliver that.
Right. So last month I had my annual physical. And this very topic that you bring up, I also think about a lot. So my primary care doctor says, "Hey, Frank, so fill me in since you were here a year ago. Tell me about your diet, your exercise, and just generally mentally, how you feeling about things in the world." And I just said, stop. Let's fast forward, hopefully 5 years. This is going to sound so ridiculous. You want me, the patient, to attest how diet and exercise and mental health and all this other stuff is doing, this anecdotal evidence from me, the patient, attesting. First of all, doctor, you don't have the time to hear about how it's really going. And then, but beyond that, imagine if we incorporated the centralization of data and insights that come with it that track the reality, the single source of truth of what really happened versus my version of it. Going back to my patient story, I thought I had the right definition. I was wrong. How did my diet and exercise really go in the last year? You know what? My monitors, my phone, all that jazz, and my devices would tell you.
Mm-hmm. You know, and bring it up, and some have heard this story with me, and some have not. So, you know, almost 6 years ago, I was probably in the best shape of my life, right? Externally, best shape of my life. I was stronger than I've ever been, right? I was cycling in Mallorca, Spain. And I mean, I have a picture, and I didn't realize how ripped I was, strong I was, right? From the outside, I'd seen the doctor just, I don't know, a month and a half before. And I was just like, and cardio was good, diet was good, right? Next morning, diagnosed with full-on congestive heart failure with a fucking EF of 12. I'm like, so if the doctor asked me the day before, how'd you feel? I'm like, dude, I'm, you know, and he's like, giddy up, you look good, go. I mean, that was the analytics behind it. So when we start to get the ability to lean in, and we start to get the ability to get that empirical-based evidence non-invasively and share that, right, with your primary care doctor, but also let's reimagine what healthcare should look like. This is another thing that drives me crazy, is we're taking legacy service in healthcare and trying to take these advanced devices that are now digital and trying to overlay them on a workflow that makes zero sense.
Yeah. Oh my gosh. Yeah. Just the value in a sophisticated individual, you know, careful with the, you know, algorithm, because you've got to have sophisticated individuals creating those algorithms. But just imagine what you can uncover if something sophisticated went through my medical history. Is it possible that we would find some amazing things, nuances in what happens? I feel for, you know, there are many folks that have a friend, family member, or they are affected by a rare disease. Rare diseases, especially with a lot of the innovations, have become this big, you know, talking point. A lot of these folks, their thing doesn't have a name for like 8 years. But then if you really had someone sophisticated dig through their data, like, oh, you know, there are subtle hints of what's going on here. And I just think that the opportunities are amazing. But to your point, I mean, there's a lot about, you know, what we've done, how we've treated, the devices that we've used, the data that we've decided not to acquire or aggregate. I mean, the amount of data that's thrown away that's not repurposed in some way in life science is just a whole other topic. But God forbid you become a patient. You wish you had those insights. You wish we did a better job on you.
100%, 100%. And then, you know, we talk about, so here's your classic visit. And again, this is healthcare bashing, not doctor bashing. So you go to the doctor, he or she, right, comes out, takes this thing called a stethoscope and puts it on your chest and says, breathe, and then goes behind you and say, breathe again, right? And takes this wooden stick and puts it on your tongue and says, ah, right? And then scribbles some things with a ballpoint pen on a sheet of paper that gets put into a manila folder that gets filed away that is never connected with any other data. And that is your standard of care. And unless they find some, think about this. I go for blood tests twice a year, like full battery. When's the last time your doctor, to provide insight, not therapeutic because you've been already diagnosed, took your blood, which is the leading indicator of everything that's right or wrong with you.
Right.
That's not even standard of care.
Right.
Until you're sick.
Yeah. Yeah. Well, we're jumping into some interesting times.
Yeah. So look, I went off on the tirade because the industry needs fixing, you know. And healthcare. This is current standard of care in healthcare bashing, not bashing my docs, my scientists, my deep thinkers, but it's a call out for, we really need to look at this. And we need to connect the pharma world, the biotech world, and the device world. Because we all know that a connected piece of information to another piece of information to another piece of information dramatically increases the value of that data point.
Oh, no doubt. Yeah. And for those that are resistant, an arranged marriage is in your future. So you better get to know the other side of the family real quick. So,
and I look at that, and I just bring that up as, you know, we sort of wrap up as, I look at the node of the healthcare. I look at the node of the biotech lady, and then the pharma lady, and then the med tech guy, all in that room that Arsenal and your team puts together in the Leader Summit. And I think that you're doing a tremendous service to the industry by connecting those otherwise unconnected dots for the most part. I think that you are really helping start that convergence and that sharing of data, because I've kept a number of connections from that if not but for, that have turned into inspirations for me to share things that I do.
That's great. Well, thank you.
So when is your next one? Can you share that with us?
So we'll be in San Diego on April 2nd. We'll be Stanford April 9th, Harvard on April 30th, and mid-May we'll be back at Wharton. So
cool. And how would they find you?
So the best place to go is our landing page for those. It's LS as in life science 2, the number 2, ls2.info. And from there, I make sure that they can find me and everything else about what we're up to.
And on LinkedIn, just Frank Dolan?
Frank F. Dolan, yeah.
Okay,
Yep.
good. I can find you there, and they should connect with you there as well.
I would love it.
I appreciate you coming in. You flew all the way down from Boston.
My
Thank
pleasure.
you for coming in and enjoying the studios down here.
Thank you, Joe.
Always be well.
All right, you too.
Bye-bye.